This is UNAIDS.
Thank you for the invitation to join you at the LGBTIQ+ Health Conference in Brussels. And thank you to EXICO for organizing this important gathering and for your continued leadership. I regret that I'm unable to be with you in person, but I want to send this message of support and solidarity to all of you. Around the world, LGBTIQ+ communities are under growing pressure. We are seeing the rise of repressive laws, violence, and discrimination in many countries. These attacks are not only human rights violations, but also undermine public health and move us further from our goal of ending AIDS by 2030. Despite gains generally across the HIV response, LGBTIQ+ communities continue to be left behind. While new HIV infections have dropped 35% amongst adults globally since 2010, they have risen by 11% among gay men and by 3% among trans people. Barriers to the provision of and access to health services include stigma, discrimination, and criminalization, as well as funding cuts and restrictions on the ability for community organizations to register and to operate. In the face of this, community-led responses continue to be a source of strength and progress. From the earliest days of the HIV response, it is communities that have led the way, demanding access to treatment, advocating for rights, delivering care, and driving change. Nothing about us without us and the JIPA principle, the greater involvement of people living with HIV, both echo in the same call, that lived experiences must be at the center of policymaking. If a program or service is created for a community, it must be shaped by and with that community. That is not about granting special rights. It's about addressing inequalities and making rights truly universal. That is why protecting and resourcing LGBTIQ+ organizations is essential. When we support community systems, we strengthen health systems. When we lose them, we lose access, trust, and life-saving care. I would like to congratulate you and thank you all for the launch of the Brussels Manifesto for LGBTIQ+ Health. This powerful document reflects the lived experiences and the collective wisdom of activists, healthcare professionals, researchers, and community organizations. I'm excited to learn that in Brussels, that vision is also coming to life through the plans to establish a new community center at the Grand Cairn site. A safe place for LGBTIQ+ people, especially those in vulnerable situations, to find support, build community, and access the services they need. I hope that the creation of this community center in Brussels serves as an inspiration for many other countries in Europe to do the same. Investing in community systems and institutions like this are not a luxury. They are a vital part of public health infrastructure and must be recognized and protected as such. I understand that this conference is bringing together activists, health professionals, and researchers, some of you wearing multiple hats. You are not only providing care, you are challenging systems, building solidarity, and shaping a more inclusive future. Despite the significant challenges facing multilateralism and the United Nations in today's world, UNAIDS' commitment to LGBTIQ+ communities remains steadfast. You can count on our continued support to advance rights, promote health, and help build a more inclusive and equitable society for all. Thank you. Have a great conference.